so this is a space that I think applies both to ADCs and small cell lung cancer and can be devastating for our patients. And this is brain metastases. So for Alyssa, the question for you pertains to what do we know about the brain penetration of ADCs? They seem like very chunky molecules. And at the same time, for Misty, the question is, I didn't hear you mention radiation in your talk. It used to be that I could never hear a small cell lung cancer talk without someone talking about brain radiation. And so I want to know, with the development of kind of incorporation of immunotherapy in limited stage small cell lung cancer, where does brain radiation stand? And so whichever one of you wants, I mean, let me just pick someone for the sake of like conciseness. Alyssa, we'll let you go
Thanks,
first.
Ibiayi. Yeah, thanks. That's actually a big oversight that I didn't present that specifically in this talk, but again, the 20-minute time frame. So we scientifically had anticipated that maybe these molecules were very big and couldn't cross the blood-brain barrier. But we've actually been surprised in preliminary data that's come out both in trastuzumab deruxtecan trials and datopotamab deruxtecan trials, where patients with brain metastases actually have had what we call intracranial response. So they have measured brain mets that have not been previously treated, and even brain mets that have been treated but have not grown more, sort of in response to the therapy. And so we've seen that in small numbers of patients, preliminary data. There have not been big publications, but I think we are now a little bit more. We don't feel as nervous about sort of relying on these agents. Just to sort of piggyback off of Dr. Shields' really quickly, there in IDXD and small cell lung cancer, there's also been good intracranial efficacy shown as well. So this is something that is a surprising but good development, I think, for our patients.
Awesome. Yeah, I think drug development always you have to think about the CNS at the same time as you think about the extra CNS space. So for Dr. Shields' answer.
Yeah, so absolutely. This is so the question is really, what is the role of radiation to the brain in small cell lung cancer in this day and age, in this era? Is there still a place? Is it still needed? And so I think that there is a place. My personal preference, my personal practice is to avoid radiation if at all possible. We have such delicate, intricate, novel agents that radiation is not whole brain radiation, particularly, which is called PCI or prophylactic cranial radiation, is not without early and long-term side effects, and that could look like tremendous fatigue, early memory loss, mood changes, weird neurologic symptoms, and so that it's not without potential toxicities. And so that is really a patient and medical oncologist and radiation oncologist discussion. What we know from the Adriatic study is that there were patients that was permitted to have PCI or brain radiation, and those patients did benefit regardless if they had PCI or not with the role of immunotherapy. So I think more to come. I know that when the original studies from Ben Slotman in the early 2000s were done with whole brain radiation for limited stage to help prevent brain metastases, there were a lot of caveats to the study. They were done in the era of CTs and not MRIs. MRIs are much more specific and sensitive to the brain. And not all patients on the study were given a scan. They were only given scans if they were symptomatic. And so for those, I do reserve pause. I think every patient should talk to a radiation oncologist and see what that entails and if that's right for them. But I think my hope is that we're phasing this out and that we only need to use radiation and targeted therapies like stereotactic radiosurgery or SRS or gamma knife, and these really targeted therapies, so we hit the cancer in very minimal areas of the brain and help patients have good quality of life, good function, and have time with their family and friends.
Yeah, so as we get more precise with our systemic therapies, could we become more precise with our local therapies as well? So excellent. So thank you both.